Are you struggling with night pain after a total knee replacement? You're not alone. It's a common issue during recovery. Today, we'll explore why pain increases at night and share effective tips to manage it so you can get the rest you need. Before we begin, if you found this video, you're likely managing recovery from a total knee replacement, considering surgery, or already in the process. The Holistic Health Roadmap can help you every step of the way. It's packed with expert tips, exercise plans, and video tutorials designed to make your recovery smoother. Get your copy now. Links are in the description and on our homepage. Okay, back to the video. Night pain often worsens because as you rest, fluid can build up around the knee, leading to increased stiffness and pressure. Additionally, inflammation tends to peak in the evening after a day of movement, making it harder to relax and sleep comfortably. To manage this, one of the best ways to relieve nighttime pain is by elevating your knee. Make sure not to place a pillow directly under your knee, as this can increase pressure on the joint. Instead, place a pillow from just below the knee down to the calf, keeping your foot elevated higher than your knee to reduce swelling and encourage fluid drainage. Check the link in the description for our recommended elevation pillow designed to support recovery and reduce pain. For those who prefer side sleeping, position a pillow between your knees to keep the surgical leg properly aligned and reduce pressure on the joint. We've also linked our recommended side sleeping pillow below to help you stay comfortable through the night. To further address swelling and inflammation, applying a cold pack around the knee for 15 minutes, avoiding the surgical site, a few hours before bed can help. Cold therapy reduces inflammation and eases pain. You can find our recommended knee replacement cold pack linked below. However, if you're experiencing sharp shooting or tingling sensations around the knee, these are common signs of nerve pain. In such cases, heat therapy can be more effective. Apply a heating pad to the muscles around the knee, avoiding the surgical site, for about 15 minutes to help relax the muscles and reduce nerve discomfort. We've included a link to our recommended red light heating pad below. To improve circulation, try walking for 5 to 10 minutes closer to bedtime. This light movement helps prevent stiffness. Additionally, perform quad sets. Push the back of your knee into the bed and hold for a few seconds. These exercises promote blood flow and prevent discomfort during the night. If you'd like to learn specific self-massage techniques to help reduce swelling around the knee, you can schedule a non-clinical virtual consultation with us. Visit our site chatwithapt.com. See the link below. And don't forget, for more comprehensive recovery strategies, from pain management to nutrition, check out our book, The Holistic Health Roadmap, available now on Amazon. It's packed with evidence-based tips to help you heal faster. If you found value in this video, be sure to like, subscribe, and leave any questions in the comments. We're here to help you on your recovery journey.